Newer IVF stimulation protocols using a GnRH antagonist instead of Lupron might reduce the risk of ovarian hyperstimulation. If your body normally produces LH in sufficient quantities, if the hormone levels get too high, if your estrogen level is elevated, and you make too many follicles, your physician may consider a procedure called Lupron trigger. Now, the advantage of the Lupron trigger is it dramatically reduces the risk of ovarian hyperstimulation syndrome. For the woman with very high levels of estradiol or rising progesterone level, embryo transfer immediately after an IVF retrieval in the same cycle may not give you the best possibility of pregnancy. Cryopreserving the embryos on the 5th or 6th day and transferring them in the subsequent cycle may not only be safer, it may be also more effective way of achieving a healthy and satisfactory pregnancy. If you've made a lot of eggs and your estrogen levels are high, your physician may speak to you about a Lupron trigger. In this situation, the Lupron hasn't been used earlier in the cycle, but is used at the time normally you would get an HCG trigger shot. The Lupron allows the ovaries to mature the eggs without the great risk of ovarian hyperstimulation, swelling, and fluid collection after ovulation. Your physician may determine that Lupron trigger is best for you. If an immediate transfer is planned during the same cycle, the luteal phase support with progesterone and estrogen may be modified to help achieve a better result. In some situations, a low dose of HCG is provided along with Lupron to ensure the best results. After you receive a Lupron trigger the next day, you'll come to the office and your doctor will check an LH level to make sure that you've responded to the Lupron with a release in LH hormone.